Hello, welcome to my channel. So today we are going to go through the medical licentiate practitioners lex course. So we are going to go through the course, but for the practical exams. Okay. So, but before we go to the practical exams for medical licentiates for the February March 2024, you have to know that this is not supposed to depict the actual exam. Okay, so we might pause and go through the disclaimer. Okay, then that the LX exam covers the theory part and the practical part. Then the practical part usually almost comes with 150 to 200 MCQs, and there is usually a surgery section, obstetric and gynecology section, internal medicine section, pediatric section, mental health and psychiatry section, and in internal medicine usually the subspecialties such as public health, dermatology. Yeah, they can be, even these can be asked. Okay, so okay, there may be of course other subspecialties as well, even dental, in probably dental and surgery. Okay, ophthalmology. Okay, so these are some of the ENT. These are some of the other subspecialties that may be asked in their respective uh, main courses. Okay, but all in all, these are the usual big five. So these are the big five. Okay, so surgery, obstetrics, internal medicine, pediatrics, and mental health and psychiatry. These are the big fives. Then the big four, if you were to cut them into four, we're going to have these. Okay, so these will have most of the MCQs. Then for mental health and psychiatry, then they also give you MCQs, but not as many as these other categories. But all you know, we have the big fives. These are the ones. Okay, and then going straight into the course, the actual practical exam. Okay, so for the medical licentiate practical exams, there was 4 OSCE questions that came in the February to March 2024 lex. Okay, then going through starting from station 1, it was about seizures, where a 6-year-old came in with a history of eating involving one side of the body. So question 1 was about taking history. Then question 2 was from your history, what 5 things would you like to know on developmental history? Okay, so basically it was just about taking history. Then in short, ask about the pre-ictal, the ictal, post-ictal, and of course, other things involved in taking history. If you don't know how to take history, when someone comes to the seizure, taking collateral history, okay, so what we are going to do is, there is a tutorial video in our internal medicine section about internal medicine history taking episode. It's about 1 hour. So there are a lot of stations about history taking. The history taking for syncope, seizures, and of course other examination findings. Okay, so we can move on to another station, which is station 2, which was about a diabetic foot. And then Wagner grading stage 4. Then a patient comes in and you make a diagnosis of diabetic foot Wagner grade 4. So there was a picture of a necrotized gangrenous foot, and you would like to do an amputation, but the patient is hesitant. So question 1, what is the diabetic foot Wagner grade 4? Then how are you going to explain to the patient to convince him to do the amputation? So okay, so the other question is, the patient asks if that's the only treatment option. Is there anything else that can be done? Okay. Then the patient also asks what exactly is going to be done in theater, then explain the process. Then verify what will be your post-op management. Okay, and actually this is a very good question itself. If it differs, if they can even bring it back, they can even bring it down to say maybe you have said someone as a Wagner, a diabetic foot Wagner, maybe grade 1 or grade 2. They tell you give someone the diabetic foot care. So they want you to now counsel someone on how to take care of the diabetic foot that they have. Okay, so that's but I'm sure even what I've said can also be put in this scenario as well, since you are aiming for the amputation. But if you do the amputation, the thing is you're going to still have to counsel the patient, because not only one leg that can be affected, or one toe or one foot, even the other one can be affected. So how do you prevent that? So to also give them diabetic foot care. Okay, that's how you do this. And diabetes is a very good topic. Make sure you have studied your practical, your practical minded, and of course you also look at the setup where you are giving the information. Okay. Then station 3 is about the pathograph, one of my favorite topics. So pathograph came in, I think it has been coming almost in most exams. Okay, because even the first one there's a pathograph. So pathograph is one of your let me just call them free marks, because pathograph you have studied. If you want information from the pathograph, yeah, we have posted them in the official Telegram channel where we chat. So after I saw this, I posted a lot of examples on pathograph and even the information to start on pathograph. Okay, so the station 3 was on pathograph. So what four abnormalities do you see? So of course, most from the information that we got, there was fetal distress. Okay, modern grade 3. So there was cessation of cervical dilatation and no descent despite strong contractions. Okay, that was most of the abnormalities that was seen. Okay, then the other question was why was this there in a section done afterwards? Like just your typical pathograph things. And of course, on the pathograph, depending on how many pathographs you've seen, there of course will be things that you have never seen before. Like maybe they may be okay, what does the X stands for? What do you put there? Like they're just trying to find out if you have actually understood all the important sections of the pathograph. But if you go through a lot of information from the pathograph, then you won't have any problems. Okay, you may have some, but not entirely a lot of problems. Okay, then this is the last station, and I'm pretty sure you're familiar with this. The only thing which you might not be familiar with are the actual questions, but I'm pretty sure you're familiar with this. Okay, not the based on the diagnosis. Okay, so I'm pretty sure you're familiar with the diagnosis. So the question that may be asked is, of course, what is maybe what two abnormalities do you see in the picture? Okay, apart from that, then what's your diagnosis? Then what imaging studies do you do? Okay, then of course, what is the treatment? I even wanted to add another section on the same, but I think I'll just post it in the community section, so that at least you take a look at another type of or another question on acromegaly. Okay, I wanted to include it here, but for the sake of it being a walkthrough, there's no end of adding another thing which was not there. I would just love to post it in the community section. So feel free to check out the community section on a worked example on acromegaly and the other questions that might be asked. But remember, the reason why we have Lex records isn't necessarily for us to master exactly what has been coming, but to know exactly what has been coming, so that if they were to repeat again, you won't have any problem with them. In our case, it is very unlikely for them to repeat acromegaly again, but if they were to do, that would be your scapegoat. You know what I mean? Yeah. Okay, probably that's the end of the ML practical exam, and pretty sure you know that this is our part 3. Okay, this is our part 3. So we have been doing this consistently for, especially for medical licentiates. We have been doing this for consistently, but we would also like to do it for doctors as well, and clinical officer general. But for the part one was of course for MLs plus, especially for the practical part, and also for medical doctors as well, since the practical exam was the same thing. Okay, that's was for part one. Then part two. So for part two, we had both for COG and MLs. Then for part 3, the same. We also had both for COG and the MLs. But this exact video you are watching is part 3, but for MLs alone. There's also another part 3 for COG alone. We have separated them. Okay, so thank you for watching, and if you haven't subscribed, please subscribe and hit the bell notification. And of course, check out all the videos I was talking about, all the other COG examination, other COG Lex recalls, and please enjoy going through the playlist for Lex recalls, and feel free to add things we have not added in the comment section, so that we have a database for the past Lex exams. Okay, see you in the next tutorial. Thank you for watching once again.